Imagine walking into your doctor's office, but instead of waiting hours for test results, you get answers in seconds. Instead of your physician flipping through thick medical textbooks, they have instant access to every medical breakthrough ever documented. This isn't science fiction. This is the reality artificial intelligence is creating right now in healthcare. But what if AI didn't just assist doctors? What if it became their brain? Subscribe for more insights into how AI is transforming healthcare one breakthrough at a time. Right now, we're witnessing an unprecedented transformation in medicine. According to a recent systematic review published in February 2025, artificial intelligence has revolutionized medical diagnostics by enhancing efficiency, improving accuracy, and reducing variability. But here's what's truly remarkable. We're just scratching the surface. In a groundbreaking collaboration between Massachusetts General Hospital and MIT, researchers developed AI algorithms that achieved a stunning 94% accuracy rate in detecting lung nodules, significantly outperforming human radiologists who scored 65% accuracy on the same task. Think about that for a moment. The machine isn't just keeping up with doctors. In some cases, it's seeing what trained human eyes miss. A South Korean study revealed even more impressive results. AI-based diagnosis achieved 90% sensitivity in detecting breast cancer with mass, while radiologists achieved 78%. For early breast cancer detection, AI reached 91% accuracy compared to radiologists at 74%. These aren't marginal improvements. These are life-saving differences. But before we explore this AI-powered future, we need to understand the crisis facing healthcare today. Physicians are drowning in paperwork. A recent study found that doctors spend an average of 15.5 hours per week on administrative tasks, 9 hours on electronic health records alone. Nearly half of U.S. physicians experience symptoms of burnout, including emotional exhaustion and decreased job satisfaction. This is where AI becomes more than just a diagnostic tool. It becomes a lifeline. According to a 2024 survey by the American Medical Association, 66% of physicians now use healthcare AI. Massive 78% jump from just 38% in 2023. And the most requested feature, reducing administrative burdens. More than half of physicians, 57%, said that cutting administrative work through automation was the biggest area of opportunity for it. The results speak for themselves. AI-powered documentation tools can reduce the time physicians spend on patient charting by 72%. Amazon One Medical reported that their AI tools reduced time spent on administrative tasks by 40% compared to industry standards. At the Permanente Medical Group, physicians using ambient AI scribes are saving an average of about an hour a day at the keyboard. Now imagine a world where every doctor has instant access to the collective medical knowledge of humanity. Not theoretical knowledge, not in journals, but practical, applicable intelligence that adapts to each patient. A study published in the Lancet Digital Health examined GPT-3's diagnostic capabilities against both lay people and Harvard Medical School physicians. The AI replied with the correct diagnosis in its top 3 choices for 88% of cases compared to just 54% for lay individuals. While physicians still performed better at 96%, the gap is closing rapidly. Research analyzing 83 studies revealed that AI models showed no significant performance difference compared to non-expert physicians. However, expert physicians still maintained an edge. But here's the critical question. What happens when AI continues to learn, adapt, and improve while human expertise plateaus? In radiology and pathology, AI has demonstrated the ability to reduce diagnostic time by approximately 90% or more. Tasks that once took hours now take minutes. Tasks that took days now take hours. This isn't just about speed, it's about catching diseases earlier when they're most treatable. But let's slow down and consider something crucial. Should we hand over the brain of medicine to artificial intelligence? The ethical challenges are profound and complex. When an AI system makes an incorrect diagnosis or suggests a harmful treatment, who's responsible? The doctor who trusted the AI, the hospital that implemented it, the developers who created the algorithm. Research published in 2025 highlights that determining liability in cases of AI errors is legally complex. We need clear frameworks to define responsibility and ensure AI systems are held to the same standards of accountability as human clinicians. Then there's the bias problem. AI algorithms are only as unbiased as the data used to train them. A study from 2018 showed that commercial facial recognition software, including AI systems used in healthcare, was less accurate at identifying faces of Black and Asian subjects compared to white subjects. If AI systems are trained on data from predominantly one ethnic group, they might exhibit lower accuracy for other populations, potentially exacerbating health inequalities rather than reducing them. Patient privacy is another critical concern. AI systems require vast amounts of sensitive medical data for training and validation. Healthcare organizations must ensure this data is collected, stored, and processed in compliance with privacy regulations. Unauthorized access could result in breaches of confidentiality, identity theft, or misuse of sensitive medical information. There's something else we need to talk about: the irreplaceable value of human touch in medicine. Healthcare isn't just about accurate diagnoses and efficient treatments, it's about compassion, empathy, and the human connection between doctor and patient. AI can analyze symptoms and suggest treatments with incredible precision. But can it hold a patient's hand during a frightening diagnosis? Can it understand the unspoken fears in a patient's eyes? Can it adapt treatment plans based on a patient's unique life circumstances, family situation, or personal values? The risk of overdependence on AI is real. If medical professionals become overly reliant on technology, we might see an erosion of critical clinical skills. The art of medicine reading subtle body language, asking the right follow-up questions, understanding context might deteriorate if we let algorithms do all the thinking. So what does the ideal future look like? Not AI replacing doctors, but AI becoming the ultimate cognitive partner. Picture this. A physician sees a patient with complex, unusual symptoms. Instead of spending hours researching and consulting with specialists, the doctor has an AI system that instantly analyzes the patient's complete medical history, compares it against millions of similar cases, identifies rare disease patterns, and suggests diagnostic pathways all within seconds. But the final decision that remains with the doctor, who brings human judgment, ethical reasoning, and personalized care to the equation. This augmented intelligence approach is already showing incredible promise. Studies suggest that the combination of AI tools and human expertise produces better outcomes than either alone. AI handles the heavy computational lifting, pattern recognition, data analysis, probability calculations, while physicians provide the wisdom, experience, and human insight that no algorithm can replicate. The American Medical Association found that 68% of physicians now recognize AI's benefits in patient care, up 5 percentage points from 2023. Overall, 35% of physicians reported that their enthusiasm for health AI exceeded their concerns, up from 30% a year earlier. We're standing at a pivotal moment in medical history. AI has the potential to democratize expert-level healthcare, making world-class diagnostics available in remote villages and underserved communities. It could reduce healthcare costs, eliminate medical errors caused by fatigue or oversight, and accelerate drug discovery by decades. But this future requires careful navigation. We need transparent AI systems where doctors understand how algorithms reach conclusions. We need diverse training data to eliminate bias. We need clear legal frameworks for accountability. We need continuous monitoring to ensure AI systems perform safely across all populations. And most importantly, we need to preserve the human heart of medicine while embracing its digital brain. So, what if AI became every doctor's brain? The answer isn't a simple yes or no. The future of medicine isn't about choosing between human doctors and artificial intelligence. It's about creating a powerful partnership where human compassion meets computational power, where clinical wisdom merges with algorithmic precision, and where every patient receives the best of both worlds. The revolution is already here. The question is, are we ready to embrace it responsibly?